Are you on Jardiance for diabetes and suddenly your hemoglobin and hematocrit is high? This video is for you. And I'm going to explain why do SGLT2 inhibitors increase erythropoietin and when does this become dangerous. Somebody responded to my video about polycythemia, why too many blood cells, red blood cells, can be dangerous. This person says, I have secondary polycythemia from taking Jardiance, which raised my erythropoietin levels, causing my RBC hemoglobin and hematocrit to rise. So, in response to his question, I have this video. So, Jardiance, called empagliflozin or other SGLT2 inhibitors, can increase hemoglobin and hematocrit levels. And this happens for two reasons. Number one is mild volume contraction. There's a diuretic effect from this medication. Less plasma volume can concentrate red blood cells. Increased erythropoietin production. SGLT2 inhibitors may stimulate kidney to produce more erythropoietin or erythropoietin called EPO, which increased red blood cell production. In most patients, this is modest and actually associated with some of the cardiovascular benefits seen in trials. So lots of patients who have history of heart failure, ischemic heart disease, we use this medication as well. But in certain individuals, it can also lead to secondary polycythemia, especially if there is underlying sleep apnea, chronic lung disease, smoking history, dehydration, and high baseline hematocrit. So if your hematocrit rises significantly, for example, more than 50 to 54%, it's important to reassess hydration, evaluate for other causes of secondary polycythemia, discuss medication adjustment with your physician, and monitor for symptoms like headache, visual changes, and clot risk. The key is to have a close monitoring. That's what it is. You have to be watchful. Okay. Increased level of erythropoietin is believed to contribute improved oxygen delivery, cardiovascular benefit, and renal protection. But in some patients, this increase can be excessive. I have not had any patient where I have to stop Jardiance because of polycythemia. When does it become concerning? It becomes concerning if hematocrit is more than 52 to 54% in men and 48 to 50% in women. If you develop symptoms like headache, dizziness, blurred vision, facial redness, blood clot, and risk increases if the patient has sleep apnea, smoking history, chronic hypoxia, living on higher altitude, dehydration, testosterone therapy. So what should be done? Always make sure there's no secondary causes, and your doctor will look into that and make sure those things are excluded. So if you're on Jardiance and your blood count is increased, don't panic, don't ignore it either. Monitor, investigate, individualize. Medicine is never one size fits all. I hope this helped you understand the science behind what's happening. Thank you for watching.